Welcome to the Medi-Cal Managed Care 101 series. This module is designed for those of you who are either thinking about becoming community supports providers or who have just started on this path. We're here to walk you through some of the basic requirements you'll need to meet to partner with a managed care plan to offer community support services. So in this video, we'll outline some of the basic requirements your organization must meet in order to qualify as a community supports provider. After that, we will review the core concepts to keep in mind as your organization delivers as a community supports provider. And we will close with select partnership requirements that we have heard from provider organizations as important to have in mind at the outset. Keep in mind, this is just an introduction. Our goal is to give you a good starting point. After orienting using this module, your contact at the managed care plan will be able to give you complete information. So let's start with the basics. What does it take to become a community supports provider? First, we know that experience matters. You need to have either direct experience or relevant training in the community supports you plan to offer. It's all about ensuring that you're well prepared to serve the community effectively. Second, consider cultural and linguistic competence. It's essential that your services are accessible to everyone and attentive to the cultural and linguistic needs of the community. This means you'll need to demonstrate your ability to engage with the community in ways that are both respectful and appropriate. Next, showing a successful history of providing these services is crucial. The managed care plan will want to see that you've not only delivered these services effectively, but also that any training or credentials needed are up to date. Finally, if you're planning to subcontract any of the work, it's important to ensure that your partners can also meet the required standards and conditions. They need to be on the same page as you in terms of quality and compliance. What about delivering the services? What should you keep in mind? Well, the first thing to keep in mind is following the rules. Every service you provide must align with the definitions and requirements set by DHCS. It would take too long to describe the service requirements for all 14 community supports in detail here, but you can find these in the policy guide. Regardless of which community supports your organization elects, there are also some common requirements that community supports providers must adhere to. Let's review these now. First, maintaining a capable and responsive staff is non-negotiable. Timely and quality service delivery hinges on your team's readiness and ability. Second, you need to be there when needed. Responsiveness is key. This means quickly acting on referrals for managed care plans, reaching out to members promptly, ideally within 24 hours, and being available around the clock to address any member inquiries or concerns. And next, we know coordination is crucial. You'll need to work closely with other providers involved in the member's care. This includes everyone from ECM providers to other community supports providers and the managed care plan itself. Lastly, consider ethics and compliance. Adhering to cultural, linguistic, and non-discrimination standards is not just good practice, it's required by law, and it's part of ensuring dignity and respect in all of your interactions. Next, let's talk about what you need to do to comply with federal law and best practices for data management and member support. Whenever you need to share members' protected health information as part of delivering community supports, federal law requires that you first obtain explicit authorization from the member. This is not just a formality, it's a crucial step to ensure privacy and trust. After securing authorization, it's important to document this consent thoroughly and confirm with the managed care plan that you've obtained the necessary permissions. This ensures that all parties are aligned and that member data is handled responsibly. If for any reason a community support service needs to be discontinued, it's not just about stopping the service. You, as a provider, are responsible for helping the member transition smoothly to other suitable programs or services. This might involve coordinating with other providers, discussing options with the member, and ensuring that they don't face a gap in support. Finally, there may be situations where you will identify other supports that the member could benefit from that weren't initially considered. When this happens, you're encouraged to proactively send additional requests for these new community supports to the managed care plan for authorization. This proactive approach ensures that members receive comprehensive care tailored to their evolving needs. It's also crucial to understand some requirements that are intended to be supportive of the partnership between provider organizations like yours and the managed care plan. First are the data sharing requirements set forth by DHCS. So why is data standardization important? First and foremost, we need to make sure that the data flowing to community supports providers like yourselves is complete and robust enough to support effective care management. This means having access to all the information necessary to make informed decisions about a member's care. Data standardization also helps managed care plans prioritize the information that they truly need. This streamlines the process, making it easier for everyone involved to access key data without getting bogged down in unnecessary details. And especially in counties where there's more than one managed care plan, Standardization minimizes the headache of having to provide different datasets for different plans. This consistency saves time and reduces errors, making your life a little bit easier. So what does it mean in practice? Well, the data guidance covers 4 types of files you may be working with, each defined with a minimum necessary dataset. This includes essential information like the member's name, date of birth, and lead care manager's name, just the basics needed to ensure everyone is on the same page. It also outlines how this information should be shared, using standard file formats like Excel, and suggests how frequently you should be updating and sharing this data. This helps maintain a steady flow of current and useful information. What about reporting requirements? Here's something to keep in mind. Managed care plans can't just pile on more reporting requirements than what's officially listed as required and mandatory. Any additional reporting can only be implemented if both you, as the provider, and the managed care plan agree to it. This mutual agreement clause is crucial. It ensures that both parties are on the same page and that the additional data collection is truly beneficial. And lastly, we need to talk about enrollment minimums. Many managed care plans specify minimum enrollment numbers that providers must meet to qualify for a contract. These numbers ensure that providers have sufficient scale to deliver effective services, but can pose a challenge for smaller organizations. If your organization is on the smaller side, knowing these figures up front helps you assess your capacity to meet such requirements. If you're ever feeling overwhelmed by these requirements, remember, you're not alone. The data guidance is there to help simplify your processes. And if you need more help, the TA Marketplace is a great resource for finding support at no cost to you. So make sure to review the specific data guidance documents linked in our resources, and don't hesitate to reach out to your managed care plan for further clarification. They're as invested in making this work as you are. Looking to dive deeper? Spend some time with the rest of the videos in this series. Review the standard provider terms and conditions and the CalAIM data guidance. And check out the trainings and tutorials on your managed care plan's CalAIM website. This is extremely important because there are differences between MCP requirements and processes, so you'll always want to refer to the information presented by the MCP you will be working with. Remember, this is a partnership journey, not just with a community, but also with the managed care plans. We're here to make sure that you have the tools and the knowledge to succeed. Thank you again for joining us. Please be sure to watch the next video in the series where we will outline the general process to deliver community support services to Medi-Cal members.